Yes?
Hi there, I'm Lillian. I'm going to be your student nurse today.
Hi.
Okay, so I'm going to provide for privacy and assessing for safety. No noticeable safety issues. I'm performing hand hygiene. Can you tell me your name and date of birth, please?
Because I am Mandregan, February 16th, 1990.
Okay, and do you have any allergies?
No.
Okay, so what brings you in here today, Keziah?
Just for checkup, I think.
Okay, great. Is there any sort of pain or issue you wanted to talk to the doctor about today?
Well, I've been having neck pain for a while.
Okay, what kind of neck pain are you having? Can you describe it for me?
Well, it's mostly just a dull pain, but like by the end of work it hurts.
Okay. What relieves that pain for you?
Usually just a hot pack or ibuprofen or something.
Sorry if you feel put on the spot. I know I'm asking a lot of questions. So
It's okay.
before our physical assessment, I have a bunch of questions that I usually have to ask people just before we start about basically your health history and hospitalizations, surgeries, any allergies, and stuff like that. And then we can get into our assessment.
Okay.
Does that sound good?
Yeah.
Okay. So, are you taking any medications currently?
No.
Any over-the-counters or herbal supplements?
No.
Nothing exciting you found off the internet?
No.
Okay. I know it seems like a funny question, right?
Vitamin.
Okay, what kind?
Well, I'm still taking a prenatal vitamin.
Oh, okay.
For my hair.
Oh, that's nice. Well, you have very nice hair, so that
Thank you.
must be working out. Can you tell me about any previous hospitalizations or surgeries?
Well, I had a baby, so I was in the hospital a couple days, and I had surgery on my foot, surgery right here on my lip, a couple times for scar tissue, and then I had my tonsils out a long time ago, like when I was 6.
Okay. Now, did any of those surgeries cause any trouble in your life? Any range of motion issues or anything?
No. Sometimes my foot hurts when it's like 40 below out, but that's it.
Okay. So when there's temperature changes, it hurts?
Yeah.
Okay. Now, can you tell me about any immunizations you've had, or do you know if you're up to date on all those?
I've had them all, I think. And
okay.
So, yeah. Last time I looked, I was up to date on them. I think because I had a baby like a year and a half ago, so they make sure that you have them all.
Okay, that's good. That's good. Have you had your flu shot and pneumovac this year?
Yeah. I think so. The flu shot.
Okay.
I'm not sure about the other one. I don't even know what that is.
Okay.
So,
yeah.
Probably not.
Pneumonia vaccination. So not every provider offers it, but if you're interested in it, we can talk to the doctor and see.
Not unless I have to.
Okay. Now, any history of drug or alcohol use?
A little bit when I was younger, but I'm over that.
Okay.
So,
any marijuana use?
No.
Any tobacco use?
I quit like 2 years ago. So.
Oh, good. That's a good thing.
Yeah.
How do you feel about home? Do you feel safe at home?
Yes. I'm good.
I know, it seems like a silly question, but you know, we're here alone right now, so if you didn't feel safe at home, you would be able to confide in me.
Oh, okay.
I could give you resources.
I'm good.
Okay, that's great.
My home is safe. So, thank you.
Okay. Yep. Just gotta ask.
Oh, okay.
All right. So I'm just gonna perform hand hygiene again because I'm OCD. and put on gloves, and we can move on to the physical assessment. So for your physical assessment, I'm going to check out your hair, your skin, your eyes, ears, nose, mouth,
Okay.
and then we'll do some range of motion and reflex testing.
Okay.
Okay, so I got my gloves on, and the first thing I'm going to do is, if you don't mind, I'm going to palpate your head.
Okay.
Okay, and just look around. Okay, and your hair is very silky and resilient, free from any lesions, pressure areas, no infestations or flaking or tenderness. I just want to note that you are sitting upright. You seem relaxed and comfortable. Your head is midline and upright, and you are normocephalic. Now I'm going to just palpate your auricles. Any tenderness?
Mm-mm.
Okay, no swelling, no redness. I would usually use an otoscope, but I defer that because I don't have that supply right now. But I don't notice any discharge, redness, swelling. Your ears are symmetrical and sit right on your head and free from discharge. I'm just going to move on. Can I have you close your eyes? Okay, and you're going to feel me touch you. Can you tell me where I touch you?
My right cheek. Left. Forehead, nose, chin.
Okay, great. So cranial nerve 7 is intact. And I'm noting that your eyebrows are full and appropriate color for your ethnicity. Your skin is also the appropriate color for your ethnicity. Your nose is midline on your face. Orbits are not swollen. They don't appear to have any entropion or ectropion. No hordeolum. Can you open your eyes for me? All right. Are your eyes feeling a little irritated right now?
No, I'm just tired.
Just tired? Okay. They're just a little red right now, so.
Oh.
But they look otherwise pretty good. Looks, your pupils are good and clear. No signs of cataracts. No discharge or anything exciting. Okay, and now I'm going to touch your face. Okay. And your conjunctiva are nice and moist and pink with no nodules or exudate or any notable issues. Now I'm going to go ahead and palpate your frontal sinuses and your maxillary sinuses. And can you bite down for me? Okay, open your mouth. Okay, no notable popping, locking, crepitus in the TMJ. And your temporal pulses are 2+ bilaterally. No hardening or thickening or noticeable distension. Now I'm going to palpate your nose. Can you close one nostril and blow out the other? Okay, opposite side. Okay, your nose is patent. No deviations in the septum. No redness, nodules, masses, or noticeable discharge. You have symmetrical nasolabial folds and palpebral folds. And I'm going to look in your mouth a little bit, if you don't mind. Okay. Can you say ah?
Ah.
All right. And do you have any trouble swallowing?
No.
Okay, go ahead and take a drink of your drink. All right. Cranial nerve 9 is intact. Can you close your eyes real tight? Open them up. Smile. Frown. Puff out your cheeks. All right. Now can I have you stick your tongue straight out? Up and down? Side to side? Cranial 12 is intact. All right. And next, I also note that your oral mucosa is moist and pink. Your teeth have good dentition. There's no noticeable caries, no missing teeth, no broken teeth. They're nice and white and straight. Excellent. Lips are nice and moist. Skin looks good. Palpate the preauricular, the parotid, postauricular, occipital, tonsillar, submandibular, submental, anterior cervical, posterior cervical, supraclavicular, no lymphadenopathy noted. Okay, now can you push your head to the left?
Yeah.
Can you push it to the right?
Yeah.
Okay, can you shrug up against my hands? Okay, cranial nerve 11 is intact. Now, I also note that your speech is clear and good tone and inflection, moderately paced. So that means your other cranial nerves are intact. I'm going to grab my pen light off the counter and I'm going to check your eyes real quick. So,
Okay.
let me turn the light down, okay?
Okay.
So I'm going to have you just stare off into the distance at that TV, okay?
Okay.
And I'm going to check how your eyes accommodate. Okay. All right. Now I'm just going to check your fields of gaze. So I'm gonna
Just keep looking there still.
follow.
Oh, follow that?
Sorry.
Oh, okay. I was wondering why you
forgot
were moving so much.
Forgot to specify.
Okay. Sorry.
So let me start over. Follow this pen. So without moving your head. Okay.
Whoops, I moved that along.
Okay. Well,
Sorry.
there is no nystagmus, no strabismus. Your eyes appear to accommodate quite well. Can I have you follow the pen? Okay. Okay, great. So your pupils are equal, round, reactive, and light accommodating. No extraocular eye movement, nothing out of the ordinary. Cranial nerve 3 and 4, yep, and 6 are intact, which is nice. I am deferring cranial nerve 1 and 2 due to a lack of the Snellen chart, and since you're not having any nasal issues, we don't need to do any testing of that.
Okay.
So, can I have you close your eyes? Okay. Can you?
Yeah, I could hear that. Left, right.
All right. So, cranial nerve 8 is intact, and you know, the smile, frown, puff up your cheeks, all that. That is cranial nerve 7 intact. So I'm going to defer testing your gag reflex, and note that there were no tonsils present as well, since you did have a tonsillectomy.
Mm-hmm.
I'm going to go ahead and palpate your neck and thyroid. Just make sure there's no masses. Okay. All right. No masses or lesions, no nodules, no noticeable thyroid swelling or anything like that, so that's a good thing. Can I have you hold my fingers? Squeeze tight. Okay. Can you... Okay, good dexterity in all of your fingers. Will you close your eyes before you close your eyes, so I need you to put your hands out and alternate touching your nose, but close your eyes while you're doing it. Okay, great. Can you put your hands down on your lap and flip them over? So supine prone, supine prone, supine prone. Yeah. Excellent. Good coordination. Now I'm going to have you stand up. Can we stand up? All right. Great. I'm going to take off my gloves and perform hand hygiene. So next, I want you to put your arms out. Okay, and try to extend against my, okay, great muscle strength. Put your arms up like this. Okay, so you were able to flex and extend your elbows plus a 5 out of 5 muscle strength. Can you go ahead and, okay, now I want you to try to press down. Okay, great muscle strength. Go ahead and put your arms down to your side. Now try to press out. All right, shoulder muscle strength equal 5 bilaterally. Can I have you sit back down for a moment? Okay. Can you put your feet out? Okay. Don't let me push down. Okay. Now try to push down. Okay. Now. Okay. Okay. So you're able to adduct, flex and extend your legs with no issues. Good hip muscles and quads. All of your muscles are symmetrical and +5. Great range of motion. Now, I would do patellar reflexes, but I can't currently at this time. If I were to do it, I would hold your leg up or have it up and hit you with a reflex hammer. Oh, well, here we go. That worked. So you have +2 reflexes in your patellar region. That's good. Nice reflexes. I'm going to glove back up and can you put your leg up here? Maybe they can see us a little better. Okay. Now, can you flex up against my hand?
Yeah.
Okay. And down.
Yeah.
So dorsiflexing and plantar flexion.
Yeah.
Great. Other side. Okay. Dorsiflex, plantar flex. No problem. Okay. Just checking out those feet. And which foot did you say was the one with the surgery?
The right foot.
Okay. Are you still able to bend your ankle in and out? Okay.
Yeah.
Great. Can you put your feet out and rotate your feet?
Yeah.
Okay. So you are able to internally and externally rotate your hips. Excellent. Now, next, what I need you to do is stand up for me. Okay. Now, put your feet together. Hands to your side. Close your eyes. Okay. Okay, great. Negative Romberg. Can you stand up and tiptoe across the room for me? And then come back on your heels?
Barely.
Great. All right, go ahead and have a seat. So your fine motor and gross motor appear to be working out well. So would you stand up for me and just walk a little bit? All right. So your gait is symmetric and opposite arm swing looks good. Upright, erect, great posture. No noticeable excessive or abnormal curvature of your spine. No joint deformities or popping or locking anywhere.
No.
Great.
Doesn't
All
feel.
right. Well, you can go ahead and have a seat. Now, is there anything else you want me to talk to the provider about or mention to him before he comes in?
No.
Okay. Well, thank you very much. I'll let your provider know. Okay?
Okay, thank you.
Okay. I perform hand hygiene and I leave the room.
Hi.
Hey, knock knock. Sorry, this is embarrassing, but I thought your vitals were already taken, so I'm going to have to take a set of vital signs. Is that okay?
Yeah.
Okay. Can you verify your name and date of birth for me?
Keziah Mandregan, February 16th, 1990.
All right, great. And do you have any allergies?
No.
Okay, great. So I just performed hand hygiene. I'm going to put on some gloves and I will take your pulse and I would take an oral or temporal temperature, but don't currently have a thermometer, and a 2-step blood pressure and assess your respiration rate without you noticing. All right, so first I'm going to take your radial pulse. 64.
Oh, okay. Is that good?
Yeah.
Okay.
It's a decent resting pulse. I'm going to just take a quick listen. Okay. So I would take the two-step blood pressure where I put the cuff around and I palpate the brachial artery. I would pump the cuff up until I stop feeling the beat for the systolic. Then I would let the air out and I would wait about 60 seconds and then I would pump the blood pressure cuff back up and listen with my stethoscope. I would pump it 30 above where I last felt the pulse and go from there. And if I had an oxygen sensor, I would also assess your O2 sat. Thank you.
Thank you.
All right, and I'll let your provider know. Thank you, bye. All right, doff my gloves, perform hand hygiene.